And today we have the pleasure of being in the presence of Dr. Lise De Wit, who is a postdoctoral fellow in clinical neuropsychology, both at the CEP and at Emory's Department of Rehabilitation Medicine. She completed her doctoral program in clinical psychology at the University of Florida and her predoctoral internship at Emory University. Lisa's dissertation was focused on behavioral interventions and building healthy habits in neurological populations. At CEP, she provides cognitive training sessions to help members maintain independence in their day-to-day functioning through compensatory strategies. So welcome, Lise. What an exciting presentation we have today. And most of us are well aware that there are many benefits to exercising. In this session, we will talk about the specific mechanisms of why exercise is so important for the brain health. There are also many other benefits of exercise, such as fall prevention and stress reduction. The specific recommendations of how much and what kind of exercise is beneficial will also be discussed. And so we will end with discussing barriers that people sometimes experience when they want to start exercising and how to overcome those barriers. So once again, thank you for joining us today.
Thank you so much, Victoria. So I am happy to be here today to talk with you about exercise and the benefits on brain health. These CEP Community Live sessions often are focused on exercise. So just like Victoria just said, you'll have a session with Aitoni coming up where you'll be getting active, and you'll have chair yoga coming up with Megan. And I think that's just shows you that here at CEP, we do a lot of different kinds of exercise. We really try to promote that. And what we don't always do is talk about why. I think basically everyone knows that exercise is helpful for us, but it is particularly helpful for those with medical conditions or those who are at risk, for example, for dementia or Alzheimer's disease. And so today I want to talk with you about what we know from kind of a research background. And I really also want to dive into how do you actually go from, sitting on the couch to really getting started. And I'll try to make that appropriate for different levels. So all of these recommendations that I'm going to talk about will apply for hopefully everyone. So let me just share my screen. All right. Yes. And so just like Victoria said, I'll be talking about exercise and brain health, why, how much, and how to get started. And just like I mentioned, I'll start off with the research, then I'll start off with the guidelines. So we're going to focus on CDC guidelines today. And then we'll talk about those recommendations that I mentioned earlier of how to actually build those habits, those exercising habits, and how to really get into it. So let's start with that research evidence base. So what we know from research is that there are a lot of benefits from exercise on cognitive functioning and well-being in general. When we look at exercise and brain health, what we know is that exercise is really linked to what we call neuroplasticity. So physical exercise is known to make both structural and functional changes in the brain. And what we mean with functional changes is that it can really increase blood flow, and that is healthy for the brain because, again, that blood really provides nutrients and oxygen to the brain, so that is beneficial. It also increases levels of neurotrophic factor, and what we know is that it increases gray matter volume in the frontal and hippocampal regions of the brain. And I'll talk with you a little bit more about that later, but those are brain areas that are really important for several cognitive functions. And what we know is that exercise is also protective for neurodegeneration. So it helps prevent cognitive decline, and it helps reduce the risk of developing a type of dementia. And just like I mentioned earlier, we've seen these benefits on brain structure and brain function, but we also see that in people's day-to-day and people's cognition. So what we see is that for those people who exercise more, we see positive effects on global cognition, so kind of how you're doing overall, but also executive functioning, so your ability to plan, organize, those sorts of higher order difficult tasks. And also memory. We know that exercise has beneficial effects on memory functioning overall. We also know that exercise is really good for heart health. So most forms of exercise, especially aerobic exercise, so walking, jogging, swimming, can help improve cardiovascular health. And what we know is that good heart health is also really essential for cognitive functioning. So there's a lot of research that shows how important cardiovascular exercise is for overall health. And just a little bit more of research on specific physical health benefits. So what we know is that when you exercise regularly, it can help you maintain coordination, agility, and speed. It also reduces risk of falling. It improves bone health, and it reduces the risk of other serious health outcomes, especially in the context of infection. So if you were to get a COVID infection or the flu, recovery would be better if you're exercising regularly overall. And exercise also lowers the risk for developing several common types of cancer. And that includes things like bladder cancer, breast cancer, colon cancer, kidney cancer, and lung and stomach cancer. So it has a lot of different kinds of health benefits. Exercise also has shown to have a lot of benefits for people's mood. We know that it boosts mood overall, and it helps reduce symptoms of anxiety and depression. So overall, it just contributes to people feeling better. And what we know too is that when people exercise, it tends to also boost social engagement. So that is particularly true if you like to exercise in a group, and we'll talk a little bit more about other benefits of that in a little bit. But it can help people get a sense of community, and that also can be beneficial for mental health and cognitive function. So there are lots of different reasons why exercise is beneficial for cognitive function, and kind of gets at that health piece from different angles. And what we know too is that exercise can lead to improved sleep quality and improved sleep patterns. So that is also beneficial for our cognitive functioning, because what we know is that restorative sleep is helpful for brain health too. So that's just a little bit more research on why exercise is beneficial for brain health. And I'd like to walk you through some of the guidelines that we have on exercise. So how much should you try and exercise, and what types of exercise are particularly helpful? Now, one really big disclaimer is that we don't want you to just jump in with trying to run a marathon next week. So check with your doctor and or your physical therapist before making any really drastic changes. Because it's important to exercise in a way that is safe for you. So to make sure that your exercise is safe for you, like I said, it's beneficial to run by your doctor what you might want to start engaging in. And what we also know is that it's most safe when you start slow and go slow. So you start with lower intensity activities, and then gradually increase, both how long the exercise sessions that you plan are, and also how frequently you do them. It's also really important that you protect yourself by using appropriate gear and sports equipment, choosing safe environments, and making sensible choices. So for example, maybe it's most safe for you to go for a walk during the daytime because that allows you to see the road, make sure that you don't misstep on any potholes in the road, and those sorts of things can help reduce your fall risk. And again, if you have concerns or you have chronic conditions that might make it harder for you or less safe for you to exercise, it's really important for you to run it by your healthcare providers. But as a main takeaway, physical exercise can typically be safe for almost everyone. So there should be a type of exercise for you that you can engage in. So now let's talk a little bit about what is recommended in terms of exercise. So we're going to walk through different CDC recommendations. The first one is to try and be active every day. So even if it's just light activity, walking around a little bit, it's important to try and try to be active every day. What we know too is that it's beneficial to do activities that improve strength and balance at least 2 days a week. So really focusing on getting stronger and improving balance. And that can be done in several different ways. But typically it includes types of exercise that work all your different muscle groups. So your legs, your hips, your back, your abdomen, your chest, your shoulders, and your arms. And there are a lot of different kinds of exercise that do that. You'll see that a lot of them are also provided here at CEP because we know they're beneficial. But they include things like yoga, tai chi, lifting weights. And again, if you're hoping to do that, we recommend starting with really small weights, working with resistance bands, and also body weight exercises. So a few things that are listed here are push-ups, sit-ups, squats, and lunges, but it can also include just, holding your arms up like this. Those sorts of things can also have really, really beneficial effects. And again, it depends on where you are, what would be most beneficial for you. And then also Pilates and things like gardening that keep you really active. So especially if you're shoveling and digging, that really requires a lot of strength, and that will really help strengthen those muscle groups. So according to the CDC guidelines for physical activity for older adults, you should also try and do at least 150 minutes of moderate intensity activity per week. So that can look different depending on how you want to go about it. It can be 30 minutes for 5 days per week, or for example, 75 minutes of vigorous activity per week. So what do we mean with those terms? So aerobic activity or cardio is really the type of activity that gets you breathing harder, and you'll feel your heart beating faster when you do this kind of activity. So that can be pushing a lawnmower, taking a dance class, walking or biking to the store. All of those kinds of activities count. So as long as you're doing those kinds of activities at a moderate or a vigorous intensity, they count towards meeting that aerobic exercise goal. So moderate intensity just means that you're working hard enough to raise your heart rate and to kind of start breaking a sweat. One way to tell if it's moderate intensity is that you'll be able to talk, but not sing. So that's one way of kind of seeing what level you're hitting. And some example activities that require moderate effort include walking fast, doing water aerobics, riding a bike with few hills. So for those, we are here in Atlanta, and riding a bike can look really different depending on where you do it. But this would really be riding a bike on level ground, playing tennis, or pushing a lawnmower. And again, you can go really hard with these things, but when it's moderate intensity, you'll feel your heart rate raised, but you'll still be able to talk. You should still be able to talk. Otherwise, you'll be vigorous activity. So here are just a few more examples of that. So you'll see, for example, light activities include moving around your home, cleaning, and walking at a slow pace. We talked about moderate activities before, so that is walking fast, swimming, riding a bike, tennis, dancing, water aerobics. And then that vigorous activity category can include the same types of activities. So you'll see swimming is in both. But again, it kind of depends on where your heart rate's at, what intensity you're doing. It is also recommended to reduce sitting time or laying down time. I've heard several physicians that I work with say that sitting is really the new smoking. It's not good for us to sit really for really long periods of time. And of course, there can be conditions where that is necessary. But for those who are able, we recommend that you get up at least every hour or so and walk around for a little bit. And that really goes with this next one. So it's recommended to break up long periods of not moving. So those are the recommendations that the CDC has listed for older adults. But how to actually get started? I know that most of you were probably aware of several of those guidelines that I've listed, and most of you are aware that exercising is beneficial. That said, to actually jump into doing it can be difficult for many different reasons. So the first way to help you get started is to really be realistic. So try and get a sense of where you're at right now. And then think about what would be a potential goal for you. So like I mentioned before, we don't recommend for you to go from primarily being a couch potato to running a marathon next week. So it's important to approach starting to exercise gradually and sustainably to also help you avoid injury or burnout. And like I mentioned before, it can be beneficial to talk to your healthcare providers, like a physical therapist, to help you do that. But if you're overall have been healthy, it's also a good idea to just think about what have you already been doing and start there, and then slowly build up from there. So that can include, if you're already physically healthy and you are able to go for some walks, starting with the length of walks that you have already been doing. And for example, if you have already been doing some exercise classes, continuing to do that and maybe increasing the intensity from there. So this is another way of showing that. So let's say you have been not really exercising at all. Starting with walks tends to be a good way to start. Now, it depends on your neighborhood whether or not that's safe too. But starting with really brief walks, or maybe you're able to walk to the end of the street, and then we recommend you do that for a few weeks before then increasing to going around the entire block. Again, if you haven't really been exercising at all very much. And that is probably true too if you have been exercising. So continuing to do what you have been doing for a few weeks, see how that's been going, and then increasing it from there. And that really helps you build your fitness level in a very gradual way. What we also know is that people tend to do best and tend to stick to exercises most if they do something that they enjoy. So whether that is walking or cycling or swimming or dancing or gardening, really whatever it is, what we know is that people tend to be much more likely to stick to it if they do activities that they enjoy. So walking when it's really, really dark and cold outside is going to be much harder than when the weather's nice, for example. If you have always been an anxious swimmer, obviously it's very unlikely that you'll stick to swimming if that's the goal that you're setting. So this is all pretty much common sense. But I think the bottom line here is that go with your gut feeling and try to actively think about what you would be most likely to stick to. And that also includes thinking about, do I like being outside, or do I have allergies and do I not enjoy that outdoor time at all? And kind of finding types of activities that match that. Also thinking about, am I an early bird? Do I tend to do best when I plan these kinds of things for early in the morning, or do I tend to do best when I do these things later in the afternoon? Really kind of thinking about what has worked for you before and using that knowledge to then plan what's most realistic for you. And I've mentioned the social benefits before. What we know is that when people find an activity buddy, they're much more likely to stick to it too. And that's because it makes it more fun. And also because when we tend to exercise with another person, we tend to hold each other accountable. And so if you end up finding an activity buddy, you'll also want to find someone that is just as motivated as you are, or even more motivated, even better, and that will hold you accountable. Another great way to do that is by joining some sort of group exercise. So for example, my gym offers all kinds of group exercises or exercise classes. And when you have the benefit of that, you'll know that there will be lots of people that are there every single Tuesday and Thursday, for example. And even within those groups, you can find activity buddies, making sure that you're all going to improve that accountability. And then I mentioned a routine before. What we know is that people tend to do really well when they have built habits. And there's a lot of research that has shown that people are most likely to continue to exercise when they have built a routine. So consistency is really key to forming those habits. Again, you can start with really realistic goals. So not having really long exercise sessions, for example, but you're still very likely to do best if you do plan that exercise, even if it's a very short session, let's say 5 minutes. If you plan that, for example, at the same time every day. So I mentioned earlier, if you're an early bird, it's great if you plan it for the mornings. If you know that you tend to do best in the afternoon or in the evening, it's great if you plan it for those times. But what we know is that people do well with habits. And so try to think about times that tend to work for you and plan it for those times, and even write it down in your calendar to help make yourself accountable and to really help yourself build that habit. We know that these sorts of things are the hardest in the beginning. And so it's really beneficial if you really try to stick to it in the beginning. And then what we know is that over time, it's going to become easier for you. You're not going to think about whether to go or not because you're always doing this because it's a Tuesday, for example. And so really helping yourself getting through those first few weeks, trying to stick to that routine is beneficial. Again, even if it's just 5 minutes, just writing that down, writing down that you'll do it, and also rewarding yourself if you've actually done it. So that is my next slide, is to really celebrate your victories with exercise. And Honestly, I think this is one of the most important pieces in building habits in general, but also definitely with exercise. So that really includes celebrating when you have exercise for the first time. Let's say if you haven't in a long time and you take 5 minutes out of your day to get started with it, you should celebrate that. You should really feel proud. And when I talk with people about these sorts of things, what people often say is, well, I'm not really proud of it because I should have been doing this all along. And that can really get in the way of feeling that joy and feeling that it's really quite big you've done. So even if you feel like you should have been doing it all along, we know that those kinds of should thoughts don't really benefit you. And so I encourage you to drop those and to really think, wow, I've done this for the first time in a long time. I actually made the effort to do this. I'm starting a routine and I've been able to stick to it for today. And then also kind of going with that, right? So being gradual with that too. So also celebrate the first week that you've done it, celebrate the first month that you've done it, celebrate that you've been able to stick to it, and allow yourself to feel proud of that because it is really beneficial for your overall health, like I mentioned before, and you absolutely deserve to be proud of that. So whether this includes an actual celebration, that is definitely encouraged too, if you'd like. So doing something you enjoy afterwards, taking a really nice bubble bath, having an extra nice dinner, doing other sorts of things that you enjoy can be beneficial. But again, just allowing yourself to feel proud, giving your exercise buddies a big high five can also go a very, very long way. So I think that's one of the most underrated pieces of forming these kinds of habits. And we really encourage you to become aware of the mindset that you have, those should statements that I mentioned before, like I should have done this all along, this shouldn't be so hard for me, and try to turn those into feeling like you can be proud of what you're actually accomplishing. So those were my slides, and I'm more than happy to answer any questions that you all have.
Thank you so much, Lise. We do have a question from an anonymous attendee. They state, I have always enjoyed walking and usually walk 4 miles per day at a fairly quick pace. I have done this for about 30 years. I was diagnosed with MCI in my mid-50s and really struggling with what to do for my exercise routine since I've always been pretty active. Do you suggest increasing the intensity time, changing it up totally? I like walking, but not very keen on running. My routine just has always included walking twice a day and some strength training. It is hard to change this habit, but I'm thinking I might have to. Any suggestions?
This is a really great question. And it sounds like this anonymous attendee has already built really strong habits. So what we know from working with people at CEP and from research is that those long-standing habits that people have built tend to really help people too when they are in that MCI phase. And so I would suggest actually continuing to do all those things that this person is already doing. So keep doing those blocks as they're safe, right? So as they have been feeling good, and as long as you aren't at risk for falls. It sounds like you're already doing strength training too. Sorry. So that is excellent. I would just keep doing what you're doing and benefit from those lifelong habits that you've already built. So I know that a lot of the things that I said were about, really getting started if you weren't exercising already, because that tends to be among the hardest things. But if you have already built those habits, then just continue to do what you're doing. Absolutely. Are there any other questions?
I don't see any other questions here.
All right.
Okay, great. Well, thank you once again. And thank you everyone for joining us today for this webinar session. Again, next week, a reminder on November 15th, we have the motor and cognitive dual tasking workout with Aya Tony. So please join us and spread the word. I have dropped information in the chat for how you can connect with the Cognitive Empowerment Program. I've also just dropped a link on how you can sign up to receive emails about CEP Community Live announcements. And yes, again, thank you for joining us. And thank you, Lise. And
Thank you so much for having me.
yes, and everyone, I hope you enjoy the rest of your day and stay active.
Stay active. Bye, everyone.